Important advice to keep you safe from coronavirus. The NHS has written a letter about coronavirus to people who have the following diseases or conditions that are considered to be very high risk. One, solid organ transplant recipients. 2, people with specific cancers. People with cancer and are having chemotherapy. People with lung cancer and are having radical radiotherapy. People with cancers of the blood or bone marrow such as leukemia, lymphoma or myeloma who are at any stage of treatment. People having immunotherapy or other continuing antibody treatments for cancer. People having other targeted cancer treatments which can affect the immune system, such as protein kinase inhibitors or PARP inhibitors. People who have had bone marrow or stem cell transplants in the last 6 months, or who are still taking immunosuppression drugs. Three, people with severe respiratory conditions, including all cystic fibrosis, severe asthma, and severe COPD. 4, people with rare diseases and inborn errors of metabolism that significantly increase the risk of infections such as SCID, homozygous sickle cell. 5, people on immunosuppression therapies. Sufficient to significantly increase risk of infection. 6, people who are pregnant with significant heart disease, congenital or acquired. This film translates the important advice to keep you safe from coronavirus that is in that letter into British Sign Language. Your safety and the continued provision of the care and treatment you need is a priority for the NHS. This film gives you advice on how to protect yourself and access the care and treatment you need. If you have one of the conditions listed at the start of this film, and have received a letter from the NHS in England, this means the NHS has identified you or the named person you care for as someone at risk of severe illness if you catch coronavirus, also known as COVID-19. This is because you have an underlying disease or health condition. That means if you catch the virus, you're more likely to be admitted to hospital than others. The safest course of action is for you to stay at home at all times and avoid all face-to-face contact for up to 12 weeks in the first instance, subject to government review. This will help protect you by stopping you from coming into contact with the virus. The exception is carers and healthcare workers who you must see as part of your medical care. If you are in touch with friends, family, or a support network in your community who can support you to get food and medicine, follow the advice in this film. The government has also set up support for anyone in need of essential supplies. Even if you do not need additional help right now, please go to the website below to register your current situation. If you cannot sign up on the website, you can call the government's dedicated helpline on 0800 028 8327 using Relay UK. If at any point you think you have developed symptoms of coronavirus, such as a new continuous cough and or high temperature above 37.8 degrees Celsius, seek clinical advice using the NHS 111 online coronavirus service. If you do not have access to the internet, call NHS 111 using the BSL service. Do this as soon as you get symptoms. You or the other person you care for should strictly avoid contact with someone who is displaying symptoms of coronavirus or COVID-19. These symptoms include high temperature above 37.8 degrees Celsius and or a new and continuous cough. Not leave your home. Not attend any gatherings. This includes gatherings of friends and families in private spaces, e.g., family homes, weddings, and religious services. Not go out for shopping, leisure, or travel. When arranging food or medication deliveries, these should be left at the door to minimize contact. Keep in touch using remote technology such as phone, internet, and social media. Use telephone or online services to contact your GP or other essential services. Regularly wash your hands with soap and water for 20 seconds. Ask carers or support workers who visit your home to do the same. The rest of your household should support you to stay safe. And stringently follow advice on social distancing, reducing their contact outside the home. In your home, you should minimize the time you spend with others in shared spaces. Kitchen, bathroom and sitting areas, and keep shared spaces well ventilated. Aim to keep 2 meters, 3 steps away from others. And encourage them to sleep in a different bed where possible. Use separate towels. And if possible, use a separate bathroom from the rest of the household. Or clean the bathroom after every use. Avoid using the kitchen when others are present. Take your meals back to your room to eat where possible. And ensure all kitchenware is cleaned thoroughly. If the rest of your household are able to follow this guidance, there is no need for them to take the full protective measures to keep you safe. You will still get the medical care you need during this period. We are considering alternative options for managing your care, and will be in touch if any changes are needed. Your hospital care team will be doing the same. We also advise the following. 1. Carers and support workers who come to your home. Any essential carers or visitors who support you with your everyday needs can continue to visit, unless they have any of the symptoms of coronavirus. All visitors should wash their hands with soap and water for 20 seconds on arrival and often. It is also a good idea to speak to your carers about what happens if one of them becomes unwell. If you need help with care, but you're not sure who to contact, please visit the website below. 2. Medicines that you routinely take. The government is helping pharmacies to deliver prescriptions. Prescriptions will continue to cover the same length of time as usual. If you do not currently have your prescriptions collected or delivered, you can arrange this by asking someone who can pick up your prescription from the local pharmacy. This is the best option if possible. Contacting your pharmacy to ask them to help you find a volunteer who will have been ID checked or deliver it to you. You may also need to arrange for collection or delivery of hospital specialist medication that is prescribed to you by your hospital care team. Three, planned GP practice appointments. Wherever possible, we will provide care by phone, email, or online. But if we decide you need to be seen in person, we will contact you to arrange your visit to the surgery or a visit in your home. 4. Planned hospital appointments. NHS England have written to your hospital to ask them to review any ongoing care that you have with them. It is possible that some clinics and appointments will be cancelled or postponed. Your hospital or clinic will contact you if any changes need to be made to your care or treatment. Otherwise, you should assume your care or treatment is taking place as planned. Please contact your hospital or clinic directly if you have any questions about a specific appointment. Five, support with daily living. Please discuss your daily needs during this period of staying at home with carers, family, friends, neighbours, or local community groups to see how they can support you. If you do not have anyone who can help you, please visit the website below. If you cannot sign up on the website, you can call the government's dedicated helpline on 0800 028 8327 using Relay UK. The letter you received from the NHS is evidence for your employer to show that you cannot work outside the home. You do not need to get a fit note from your GP. If you need help from the benefit system, visit the website below. 6. Urgent medical attention. If you have an urgent medical question relating to your existing medical condition or the condition of the person you care for, please contact us or your specialist hospital care team directly. Where possible, you will be supported by phone or online. If your clinician decides you need to be seen in person, the NHS will contact you to arrange a visit in your home, or where necessary, treatment in hospital. To help the NHS provide you with the best care, if you need to go to hospital as a result of catching coronavirus, we ask that you prepare a single hospital bag. This should include your emergency contact, a list of the medications you take, including dose and frequency, any information on your planned care appointments, and things you would need for an overnight stay, snacks, pyjamas, toothbrush, medication, etc. If you have an advanced care plan, please include that. 7. Looking after your mental well-being. We understand that this may be a worrying time, and you may find that staying at home and having limited contact frustrating. At times like these, it can be easy to fall into unhealthy patterns of behaviour which can make you feel worse. Simple things you can do to stay mentally and physically active during this time include: look for ideas for exercises to do at home on the NHS website. Spend time doing things you enjoy: reading, cooking, and other indoor hobbies. Try to eat healthy, well-balanced meals. Drink enough water. Exercise regularly and try to avoid smoking, alcohol, and recreational drugs. Try spending time with the windows open to let in fresh air, arranging space to sit and see a nice view if possible, and get some natural sunlight. Get out into the garden or sit on your doorstep if you can, keeping a distance of at least 2 meters from others. You can find additional advice and support from Every Mind Matters. And the NHS Mental Health and Wellbeing Advice website. Further information. Further information on coronavirus, including guidance from Public Health England, can be found on this website.